I'm very glad to introduce Dr. Jeanette Erickson, and we will be listening to her recording.
Good morning, colleagues. I'm so happy to be able to join you today, even though quite a few miles away. But I'm looking forward to our conversation about professional governance, especially the path forward. I'm hoping that through this session, we will be able to review the benefits and the principles of what I call shared decision-making. We will be able to describe the structures for decision-making, collaborative decision-making, and we will be able to discuss opportunities for the future. I think it's incredibly important to reflect on the history before we talk about the path forward. In fact, in the original Magnet study, it came to light that through staff weighing in and bringing voice to important organizational decisions, that organizations were able to attract and especially retain nurses. And in fact, that is what has happened through the journey of Magnet to ensure that professional governance is a core principle. I want to make sure that we don't get hung up by the terms. I want to focus on those principles. There has been an evolution in the language of shared governance or collaborative governance to professional governance. The bottom line is that there is evidence on the value, the outcomes, the engagement, the important communication, the chance for professional development and opportunities and job satisfaction. So I try to say in its simplest form, governance that is shared decision-making, collaborative decision-making are based on the principles of partnership, equity, accountability, and ownership for the decisions that we make. So here I'm trying to share with you the definitions of the differences between shared decision-making, shared governance, or collaborative governance, and interprofessional shared governance. But the important part is, in fact, the definition that Magnet puts to this. And we in the world of Magnet believe a dynamic partnership between leadership, clinical nurses, and other healthcare professionals must promote collaboration, must facilitate deliberation, and of course, decision-making. And there needs to be a fostering of accountability, especially for improving patient outcomes, quality, and enhancing work life. And I always say an accountability to the team, making sure that the team is intact and that the team is safe. Decision-making versus, which is participatory management versus shared governance, is laid out in this slide. But the important thing is to think about, what are the goals? What are you trying to achieve? Making certain that staff who have the knowledge and the information can weigh in, that you can participate and you can incorporate your input into all of what's being discussed at the organizational level. Leaders must clearly articulate the guidelines for decision-making. You can't be given a task and not the funding. You must know what the barriers are and what the opportunities are. And leadership style must be as a servant leader. Leaders wanting to help staff, develop staff, and hold staff up. And then we must understand that decision-making must be decentralized, and sometimes decentralized to the unit level, to the individual level, and sometimes in big systems are decentralized to the organizational level. So Magnet, our program, our value for decision-making is that there's the expectation of professional governance that is really fixed in the healthy work environment model. And of course, this is not only for Magnet, but Pathways to Excellence. And there are requirements for structured empowerment and shared decision-making. There is no question. We have no question of the significance and the importance of this, and that nurses must have control over practice and must bring voice, give voice to all that is related to the care of patients and that safe environment of care. So there are many structures, decentralized to the unit level, centralized functionally, evolve models that can be interprofessional and may address practice from a really mixed model. And so we, as the path forward here at Al-Musa, need to decide what that structure is. And it may vary by organization, and it may vary by the decision being at hand. So at my organization, the Massachusetts General Hospital, we call it collaborative governance, and it's the decision-making process that places the authority, responsibility, and accountability for patient care with the nurses, the practicing clinicians, those caring for the patient, those responsible for the patient care. So it's based on our belief that a shared vision and common goals lead to a highly committed nursing workforce. And we also believe that being held accountable and making decisions for the patients you are caring for actually lead to an enhanced productivity because participation is empowering. So it's nurses will, in our system, we believe that nurses will make appropriate decisions when there is sufficient knowledge and that we understand where we are headed as an institution. So what's the vision and what do you really believe in that my role as a nurse will help in the advancement of care. So this is our interprofessional professional practice model. Our belief system is that nurses and all health professionals, as well as our support staff, should be involved in our professional practice model. And of course, all that we do is around the patient, and our belief is in relationship-based care. And so you see, we believe that bringing all the pieces of the puzzle together really help us to develop the way we are going to improve care delivery. And collaborative decision making is an important component of who we are and what we do. So the transition to shared decision making, this path forward that you all are thinking about, I believe is that the journey starts here. The journey starts today with everyone coming together with a collective vision and really understanding what we bring to the table. So it's about decision making. It really, the destination should never be today. The destination is tomorrow and the day after and the day after and the day after. Always wanting to improve that practice model, the environment of care, and really making sure that nurses continue to add value. So progress is gradual, progress is purposeful. All of the progress should be evidence-based. We really want to have an evidence-based practice. Evidence should be driving who we are. And of course, all of this requires cultural change. It starts at the organizational level, and it ends with me, the clinical nurse, on behalf of the patients that I am caring for. So the best practices to build a culture of accountability is to be a role model, build partnerships, set clear outcomes and expectations, agree on what the organizational behaviors are, practice transparency, making certain that we share the truth, we tell the truth, and we really share what our expectations are. Practice transparency. Bridge the needed resources, making certain that we do not go on a journey when there are no resources, or even if there are limited resources, we should say that. Be transparent about what resources are available. Absolutely celebrate, recognize, and reward contributions, and make certain that the evaluation is always done and it's done together. No surprises, no surprises. So the guiding question is, what committees do you need to effectively manage your practice? How do you set up a collaborative decision-making committee structure where everyone can bring voice? You, of course, want to evaluate practice. You want to evaluate the quality of care. You want to develop new practice models, as well as nursing interventions that are through evidence-based practice. When applicable, you want to generate new research, or you want to bring in researchers who can help you to evaluate. You want to advance diversity, equity, and inclusion. And I call this JEDI, justice, equity, diversity, and inclusion. You want to make sure that this environment is ripe for learning. You want to educate people on practice. You want to have evidence-based practice rounds. You want to have evidence-based practice discussions. They could be book clubs. They could be huddles, morning huddles, where you talk about the latest. You talk about quality and patient safety. You talk about the environment of care. In my organization, we begin every morning with a huddle, bringing in clinicians, administrators, and all support staff. You always want to evaluate resource utilization. In this day and age where resources are scarce, you want to make sure that you're not overutilizing resources, and you don't want to underutilize the wonderful resources you have. And of course, you want to have oversight of the structure. You want to make sure that the chief nursing officer is aware of all that is happening in the collaborative decision-making arena, to make sure that she is ensuring and helping to guide all of you, and really making certain that other members of the organization are aware of what's happening in the collaborative decision-making structure, so they too can celebrate your outcomes. So again, I want to share with you, and maybe one of the things that you're wondering is, what is Jeanette talking about? Do we have examples of collaborative decision making? Well, I'm going to give you my examples, the way in which I set up the Massachusetts General Hospital. There was the executive committee that really is there to hold up and support excellence in care delivery, and to make sure that there's a level of coordination of what's happening at the organizational level with what's happening in the Department of Nursing. Then you want a coordinating council that brings in project people that are supporting collaborative governance committees, as well as the chairs of the committee, where you can make certain that you are not all working on the same thing, that there is a level of agreement on who's doing what and how things are done. And then, of course, there are all the practice councils. Then there's that almighty evidence-based practice council. You might decide to have a research council, and you might decide to have a leadership council to make certain that staff are being supported. You want a professional development council. You want that diversity, equity, and inclusion. Of course, you want quality. You might decide to have unit-based councils. That's the path forward. You might start at the unit level, or you might start at the organizational level and move down to the unit level, or unit level up. If you have thinking about those advanced clinicians, you might do that, but that would be the last of your councils. And then any other council the organization needs. So colleagues, the future is in your hand. I hope that this presentation really helps you to think about collaborative governance, shared governance, professional governance. I believe you're going to call it professional governance. This is information. These are signals, data input, things for you to think about throughout this conference, and how you want to set up your structure for the future, not for today, but for the future. So colleagues, again, I'm glad to be with you, and I want to thank you, and I will be available for questions when that part of the meeting happens. So thank you.